Good morning, Med Center. Welcome to our town hall meeting. Thank you all for tuning in. And thank you again for the amazing, great work that all of you do every single day. We really, really appreciate it. We had a great grand opening of our restorative care village. So thank you everyone who joined us virtually for the groundbreaking or ribbon cutting opening ceremony of the LAC+USC Restorative Care Village. If you did not join, you can watch the replay or schedule an in-person tour of the facility. They're great facilities. I heard that they were the best recuperative care beds in the country. So this is what our community deserves, and this is what they're getting. But if you have a chance to go on a tour, schedule it. The next tour will be the 19th at 9 a.m. and we'll have a shuttle to take people from here over to the Restorative Care Village. So RSVP your seat there. Last week and yesterday we had events to recognize the core sterilization of women that happened here in the late 60s, early 70s. And we had a virtual panel discussion to talk about it. We had the lawyer who was involved in the lawsuit against the county. We had the resident who was the whistleblower, and we had the producer of No Más Bebés, which is a documentary of what happened here. And then we also unveiled the artwork, Sobrevivir, and artist Feng Win was here to describe her vision for this artwork, which is a very powerful artwork. So you're all encouraged to go take a look at it. Let's see, special shout out to the following teams who made all this possible. Supervisor Solis's office, the Wellness Center, Claudia Mata's team, Gabby Gonzalez and the volunteer team, our PIO and the IT digital media team, Bill Walton and facilities team, including Patrick O'Connor and his team, Art Cruz. So thank you all for working as a team to make Sobrevivir celebration a success. Let's see, nursing grand rounds today at 10 a.m. The topic is when we bring the team to you, the hospital emergency response team, which is an amazing team. So please join us for that. Also, Schwartz rounds are today from 12 to 1. And today's topic is a timely discussion about the impact of gun violence. So please join the Schwartz rounds. And then this week, Changing Culture. Special guest is Dr. Laura Sarf. Don't forget to tune in this Thursday at noon. It will be a great discussion about how Dr. Sarf and our leaders have learned from their mistakes. Really, this is an effort to encourage people to be safe in sharing their mistakes, and that leads to a safer hospital, a safer clinical practice. A few shout outs. Our team at the East San Gabriel Valley Hub in El Monte, thank you all for the amazing work that you all do. And then also our radiology team on the 3rd floor of DNT. Thank you so much for the great work that you do. Dr. Spellberg.
We were going to do a shout out. I guess it didn't make it, so maybe we'll save this for next week. But to preview is one of our Ward 70 has just been crushing it on COVID vaccinations. They have team shirts that because they keep winning every month the challenge, like 6 months in a row. I apologize that it didn't make it in this week. Next week, we will give you the formal shout out. Right. So please tune in next week for that.
Thank you.
Our COVID situation is, so it reminds me of that movie, Good Morning Vietnam, when he was talking about the weather continued blankety blankiness. It's just the same. It's not changed. It's been the same. It's like 2 months of the same. You can see county-wide numbers with the top graph. It's just, it's like plateaued and it's not going down. It's sort of trickle up a little, but really not much. It's just been like that. And we're getting thousands of cases per week across the county. The numbers at LAC, COVID positive tests, have continued to go up, but this isn't because we're seeing a ton of people with symptomatic disease getting admitted. If you go to the bottom graph, it's the same thing. We're seeing a lot of people with mild disease in urgent care or ED who go home and do not get admitted. And of those who are admitted, they're 90% of the time not admitted due to COVID. Only 10% of our COVID positive admissions are admitted due to COVID. Virtually none of them go to the ICU. And when they do go to the ICU, it is not for pneumonia. They are not intubated. They are not these horrible 100% FiO2. We haven't seen one of those since February. It's been months. What we see is electrolyte abnormalities, or somebody who had an autoimmune attack of the nerves, and could that have been related to COVID? That's the kind of stuff that we're seeing. It is just not the same pandemic as it was, despite all the media hype to the contrary.
Yeah, public health is scared.
A lot of people have bad colds, is what we're seeing.
I'm going to really have to work to burst that soothingness bubble. Maybe we can turn to the media, which is trying to burst that bubble by talking about yet a new variant that was described in India, sweeping the country. And now in the United States, the numbers will continue to go up. And indeed, the numbers in many areas are going up. That is the number of people who are testing positive. Although we have to understand that, first of all, most of that data is completely incomprehensible because at the moment, many people are testing at home and most people aren't reporting those tests in. So no one has any idea actually how many people are testing positive at that point. Certainly, if the experience of our hospital is reflective of across the county, which I believe it is, we're just seeing nobody with severe COVID disease. As of this morning, we have no one in the hospital who had pulmonary disease due to COVID. Nobody in the hospital. We have 24 people who have tested positive for COVID, but nobody who had COVID-19 disease as we would see in the past. So I guess it is hard to get a little more excited. Dr. Barbara Ferrer is expected today, based on numbers, to probably announce that LA County will go into a mask mandate situation for all indoor and large activities. That's expected to be announced this afternoon, but we haven't seen the final numbers that she may or may not choose to act on at that point. But certainly there's no reason from a hospitalization due to COVID perspective to be worried at this point. Yeah. I'm so tired about not being worried about COVID for week after week. The very least we can do is bring up another potential pandemic and get worried about it, because at least that way we have something to be worried about. And so we should talk for a moment about monkeypox. There's actually one or two reasons we should. First of all, monkeypox in certain areas of the country, particularly New York City and Los Angeles, is in numbers apparently exploding. One of the problems we have is testing is almost impossible to get right now. The CDC is the only one that can test, but now they've sort of stopped their testing. Public Health, just as of a day or two ago, has now moved the testing to private labs, but it's not quite clear how we can order that test. So we're struggling with some challenges about testing, but the numbers are probably much higher than we know. But there are a few things, and we've seen a number of patients here at LA County, some of whom may indeed have monkeypox in the ED, because we're getting calls now several times a day in people in the ED who may have monkeypox. So there are a few things that we should be aware of. First of all, people who are most at risk for monkeypox are confined to a few small groups. So most people are not at risk for monkeypox right now. But secondly, in terms of concern, monkeypox is spread almost exclusively by contact with the lesions, that is skin-to-skin contact. There's question as to whether there might be some droplet, but that isn't clear at all. It doesn't matter because everyone is technically in droplet precautions because everyone in the hospital is wearing a mask and continues to wear a mask. But if there is someone who comes in with monkeypox, one should practice appropriate contact precautions because spread is from the virus, which is on the skin, associated with the lesions. So there's no reason for us to panic about monkeypox. If you're caring for a patient with monkeypox, you simply do standard contact droplet precautions, as we've been doing for COVID. Although this is not a respiratory disease, it really is a contact disease. For people who are very, very sick, there is a small amount of an FDA-approved drug, but only approved for smallpox, that can be obtained from the CDC, although very, very few people get very ill from monkeypox. And finally, there is a vaccine for monkeypox. That vaccine is in extraordinarily short supply. New York City, but not Los Angeles, has opened vaccine clinics. Unfortunately, hours after they opened the sign up for their first vaccine clinic, it sold out. Well, the website crashed, but all of the vaccines were taken. They are supposed to announce tomorrow, I think, they open up the website again with a small amount of extra vaccine. But honestly, we don't have much vaccine in the United States. They're working to increase that.
Well, that's not very soothing.
Well, good. I managed to get a little less soothing. But it should be soothing in the sense that all the people who are caring for these patients here should be soothed that this is not something that's going to spread to you. Just practice appropriate precautions, hand hygiene, gloves, gown.
Great. On to our questions. We are live. Please submit your questions or comments. We'll try to get to them. It's no secret the position of nursing attendant has been understaffed for quite some time. New employees work for a few days and then leave because the amount of work does not match the salary being paid for the position. Would a raise for the NAs that are still working here be too much to ask? Great question, and it is true that we have several vacancies for nursing attendants, and they are an incredibly important part of our workforce. And as you know, in the county, as CEO of the hospital, I don't really have the power or ability to give people raises. All of this happens through every 3 years. There's a negotiation between the county and the represented unions to negotiate those. The good news is that nursing attendants are getting a significant raise during these negotiations. Now, the contract has not been ratified by the members, and we hope soon, when that ratification happens, we're able to announce all the raises that will happen. So thank you for the question. I've noticed an increase in homeless tents and trash on Marengo Street in front of the hospital parking lot. What is being done to decrease this problem and staff safety? Thank you for your question. Our staff safety is our #1 priority. We, as of 2 weeks ago, pulled in our security people, we pulled in our social work staff, and our contract staff through Exodus that does outreach to homeless individuals on or around our campus. And so we've redoubled our efforts to make sure that every individual is approached, is contacted, is offered services, and if they're not willing to take services, if they are on our property, they are asked to move on. So we are redoubling our efforts on that front. Let's see. The lunch offerings in the cafeteria on weekends are dismal. No salad bar, no sushi, no freshly made sandwiches. Only refrigerator case sandwiches that are good until July 22nd. And here we are, only July 9th. That alone justifies a visit to the emergency room. And worst of all, no tapatio on weekends. Yeah, that is a crisis. So we will pass your feedback on to our food service folks, and we should hopefully have a response and an answer soon. Consider placing a large advertising banner behind home plate at Dodger Stadium. Great TV opticals. Now, Dodgers doing great this year. LAC+USC right behind home plate would be wonderful. the tens and thousands of dollars per game that costs. If you have any donors that want to help us do that, we'd be happy to do that. But we really do not have a budget to advertise that at that level. Will there be additional employee engagement for the core sterilization discussions? Yes, we are planning a very special shorts round, interactive shorts rounds to continue the discussion on the core sterilization practices that happened here many decades ago. I heard that monkeypox outbreak at LAC. There's a monkeypox outbreak at LAC+USC. Is this true?
No.
No.
We have seen 4 patients where monkeypox was suspected. Only one of those has been confirmed. One of them there was really no reason to suspect, and the other 2 testing is underway. No one has been admitted to the hospital. All had minor illnesses and went home after being seen. Now, in Los Angeles County, there appears to be a significant increase in cases, and there is great concern with public health. But at our hospital, no.
The CDC have issued a health advisory today to inform clinicians and public health departments that PEV, parechovirus, is currently circulating. Can you please elaborate? This is not very soothing.
This is not very
different,
soothing. Are
not
you going to
monkeypox.
talk about the unsoothingness of parechovirus?
I have no concerns about paraechovirus.
So-
you'll have to do that, Paul.
Parechovirus is currently has been identified in a number of children who have fever. Some have seizures associated with their fever, and it's another similar virus to many that are circulating, many of which we can't identify anyway, but they're recommending if you have a case of an ill child where the illness is not identified, you could check for parechovirus.
Do you remember a long time ago in the distant past when what we did is we said, oh, you have a cold? Go home, take some chicken soup. What happened to that? There's how many viruses that cause human disease of URI nature, Paul? 150?
At least.
You don't typically do very much because you don't have a specific treatment for them. You take Tylenol and stay hydrated and stay away from other people so as to not spread it, right?
If we see more cases of parechovirus, perhaps we could do a randomized controlled trial on chicken soup.
I'm willing to do that. What should we use for placebo?
Water. Okay. Question from the chat. Is this variant, I guess coronavirus variant, as strong as the Omicron variant?
It can bench press 350, so it's pretty strong.
It's a hard question to answer because you may have noticed that after great excitement about going through the Greek alphabet, the researchers have got kind of stuck at Omicron. And so instead of going further and further beyond Omicron, they've now said they're all Omicron with another English letter followed by a few numbers. So it's unfortunate. I was hoping we would at least move onward, but we are stuck at Omicron at the moment. So I don't know which variant you mean because there are a number of variants, B 2.4, 2.5, 5, a variety of variants that are now circulating that people are concerned about. The most recent one is, as I mentioned, the one that was identified in India and appears to be driving a major portion of the cases in India where the number of cases has shot up. Is it as communicable as some of the other Omicron variants? It may be more communicable, at least epidemiologically, that seems true. If by strong, do you mean it causes worse disease? The easy answer is, so far, nobody actually knows.
All I can tell you is we're not seeing severe COVID, and we haven't for quite some time. Also, I really do like going to the gym in the morning. It makes me feel healthy.
And you can certainly do that while masked after Wednesday.
It is
Or after Wednesday
theoretically
afternoon.
possible to go to the gym while masked. It is, however, much more difficult to vigorously exercise while masked. I would.
Yeah, I play basketball, and one of my teammates wears an N95 throughout the whole game. I don't know how he does it.
Wow, that is dedication right there.
That is dedication. I do want to recognize that we have a significant number of employees who are testing positive. They're not very ill, but with a positive test, they need to quarantine and isolate. And it causes significant challenges in terms of coverage, in terms of providing appropriate care. And, we thought we were past this, but apparently not. And it is challenging our ability to deliver safe, effective care.
And can I mention that there is really no evidence that people are acquiring this here at work? COVID-19 is widespread right now throughout the community, and everyone who is reported we look at as a possibility of work spread. It's very, very hard to tell that anyway, although interestingly it's less hard because the number of cases here is so much less, tenfold less than it was at the peak of our time. So it is a little easier to look at it, but really most of this seems to be community driven.
Another question from our chat. Is it possible to put signs near Lot 9 exits stating to watch for pedestrians? Cars drive out quickly and don't see pedestrians walking. At least once a week, I almost get hit. Thank you for your question. We certainly will follow up on this. If I can ask for a favor, can you take a picture of exactly where you think those signs would be helpful and send that to me, and we will follow up. So thank you all for tuning in. We have a couple of videos for you to share. The first is a Channel 4 coverage of our event, the unveiling of Sobrevivir, the artwork, which was a great event. And then a video about the art piece and the artist sort of explaining the meaning and the engagement of our community throughout that process. So enjoy, and we'll see you next week.
During the late 1960s and early 1970s, hundreds of women underwent questionable sterilization procedures after giving birth at LA County USC Medical Center. Today, challenging new artwork is being revealed, calling attention to the hospital's complicated legacy. Our Annabelle Munoz has more.
An art installation unveiled today now sits at LA County USC Medical Center, titled Sobrevivir, which in Spanish means to survive.
This was tied specifically to a 2018 apology for the practice of coerced sterilization that asked us to partner here to create a commemorative artwork or memorial.
In the 1960s and 70s, more than 200 women, largely Mexican immigrants who gave birth at the medical center, were sterilized. Many saying they were not informed, were coerced, or misled into signing forms they could not read.
I want the art to be impactful and meaningful and create a deep experience for contemplation for viewers. The material is made of metal to symbolize the mother's strength, and I want this to last forever.
The artwork is surrounded by the words of the women who were directly impacted. Many of those quotes are from survivors interviewed in the documentary No Más Bebés, or No More Babies. The film's director and producer were there today.
If you don't speak English, they treat you another way. That quote was stated by Consuelo Hermosillo.
The women in this case were so courageous and fought so hard and made a difference for a lot of generations to come, but they never had personal justice. And I think that also makes it really bittersweet.
Some survivors have passed away, including the godmother of Monica Alcaraz.
I'm very proud and happy that I've been vocal and, been able to support the community and what they wanted. One of the things that they wanted recognition, that's why they had the ceremony today.
LA County Supervisor Hilda Solis, who hosted the ceremony, co-authored a motion in 2018 to issue a formal apology to the women. Most recently, she's urged the state and the county to explore paying reparations to survivors.
We know that there was state legislation, but it was more for state facilities, so there has to be another effort made.
Annabelle Munoz, ABC 7 Eyewitness News.
in the summer of 2019, there was a call for artists to apply for this opportunity to make artwork on the coerced sterilization recognition project here at LAC+USC. It is such an impactful story, something that's extremely tragic and sad, but an honor to be able to do that, to be able to make work about the mothers who survived. The word that really describes the tone of this artwork is sobrevivir. Not only survival, but keeping alive the stories of the mothers and the legacy of how these mothers fought for so many generations of women after them to protect their reproductive rights. And the site where the artwork was going to be was a large circular labyrinth stone that was a little over 21 feet in diameter. And when I saw the site, it looks like, almost like the Sistine Chapel when Michelangelo designed the colonnade to be like an arm embracing, so that when you visited the chapel, you're supposed to feel like a divine embrace. And I kind of felt that when I visited the space. So I didn't want whatever artwork I came up with to erase the location and its feeling. When I watched the documentary No Más Bebés, there are certain quotes that were really, really important to me that I wanted to be included in the artwork. One was, if you speak English, they treat you one way. If you don't speak English, they treat you another. And for me, being a refugee and immigrant, this is something that I completely understand. And this is really important. This artwork is about apology. I was commissioned by the county to create an artwork that exposed what happened and to apologize for it. And something that was really important that both Virginia and Jorge said was, this artwork has to be impactful.